we're taking care of patients with chronic kidney disease and they come and see us in our office, it's important to see them early on in the disease process because, it's a lot to take in for patients. This is something entirely new. This is Greek for them. This is something entirely different. They've never known they've had kidney problems, and if I'm to see you today and tell you you're going to need to start dialysis tomorrow, it's a lot to process. There's you go through stages of denial, you go through stages of disbelief. So it's helpful for us seeing patients earlier on in the process and starting the education about what to expect in the future. What to expect if I'm going to be starting dialysis. How do I prepare for starting dialysis? How do I make my choices amongst the options for dialysis options or transplantation? So these things are not things that happen in one office visit. This is what takes time. This is what we call chronic kidney disease education. And that's why what we find is when we do this and we use multidisciplinary approach, not just with physicians, we use physicians, we use dietitians, we use nurse practitioners, and a specific time allotted to educating patients about their kidney disease, and it's okay to tell them what to expect in the future. The common thing amongst physicians is to say we don't want to talk about dialysis because no one wants to talk about it. It's the elephant in the room, right? No one wants to talk about it. No one wants to mention the word dialysis because that's what everyone's afraid of. But rather than burying our head in the sands for it by being educated about it when, and hopefully far off in the future when the time comes that you need to entertain the options of dialysis, you've been educated, you know what to expect, the transition is easier, you're able to educate your family and your loved ones and your work about what to expect about doing this, and that makes for a much smoother transition. Again, it's not something that anybody wants to do. It's nothing that we want for our patients to do as well, but our job as physicians and advocates for our patients are to educate them about their kidneys and what to expect in the future. And by doing this, we find that patients get started on dialysis with better preparations, either with starting peritoneal dialysis or an AV fistula in their arm, which is a type of way we can do the dialysis to help reduce infections around starting dialysis. These are things that we can do to help improve their outcomes, and it's something that takes time and it's something no one wants to talk about, but by taking the time to talk about it and address it head on, we usually can result in better outcomes.